Telehealth is a term that we use for providing health care using some kind of a remote communications technology. It could be very simple, such as a phone call or leaving messages for one another, or it could include live two-way audio video.
With TeleHealth Stroke, we are able to provide neurologic consultation to all of the hospitals within our Intermountain system where there are not neurologists on site to help evaluate these patients. So this is helping to unite all of our providers in our different locations, all of our larger hospitals and our smaller community hospitals. We're making sure that no matter where a patient gets their care, they are getting optimal stroke care through our TeleHealth Stroke program.
One of the unique features of the program is having a full-time infectious disease telehealth pharmacist. And so that individual actually does surveillance electronically using a special software system to look at certain antibiotic use, certain infectious disease conditions, and sees opportunities where we can be better at our use of antibiotics. If we have a situation where we feel it's important to talk to the patient, get a detailed exposure history to see if there's other infections that we might be missing or that we need to test for, then we will turn on the camera and talk to them. And that's really what we think of as like the true spirit of telemedicine. Instead of us being in person doing this, now we're doing this, but with a camera and a monitor.
And I think the more we started using telehealth, the more we realized it was an opportunity to help people and to really keep babies closer to home if possible and to help guide resuscitation. So in the last several years, we've grown over several fold from around 80 interactions in the first year to over 800. So it's exciting to see. We've spared a lot of transports and it's growing almost faster than we expected. So.
We've seen tremendous growth in telemedicine over the past 5 years and particularly over the past 3 months with the COVID outbreak, where there's such a need to have access to caregivers in a remote fashion so you don't need to go outside to be exposed. And again, to have that convenience and that access, it's just been tremendous. And you're gonna see even more growth going in the future. People are gonna demand this ease of access and this convenience. And telehealth done right is very convenient for the patient and for families and also for the providers.
We see a tremendous human benefit from patients being able to receive care close to home. They're surrounded by their loved ones and their family members can come in. You know, often there are issues when one person is critically ill in the family with care of other family members, either older or children, care of pets, and in our rural areas, often care of livestock. And it makes it much easier for the closest circle of the patient to be able to keep the other aspects of their life going and still be a meaningful presence if they stay close to home in their community. And it goes beyond that. People who are, neighbors, church members, close friends can all be a much bigger part of the person's recovery. And we see that people do recover faster when they're surrounded by their loved ones.